How to treat and cure muscle fatigue. Feeling pain or soreness after a strenuous workout is usually enough to deter people from another workout session. Muscle soreness that happens 24 to 48 hours after a workout is called delayed onset muscle soreness, DOMS. It happens because while working out, small tears form in the muscles, which cause damage to muscle fibers. When the muscles are torn, then there is inflammation, and experts believe that it is the combination of the tears and inflammation that causes soreness. This, however, is not a bad thing. As the muscles heal, they are strengthened, which causes the muscles to become larger and stronger. Recovering from workout soreness is facilitated by implementing a few post-workout strategies. Here's how to recover from workout soreness. Work out every other day. By working out your muscles every other day, you're giving them a chance to recover. Strength workouts daily will just continue to fatigue your muscles without any of the benefits that come from allowing muscles to heal. Either work out every other day, or do strength exercises on one day and aerobic exercise the next. Staggering your workouts like that will help you recover faster. Eat a high-protein snack. Eating a snack that is high in lean protein after a workout will help give your muscles the fuel they need to recover more quickly. Egg whites, lean chicken or turkey, and low-fat or skimmed milk are all high-protein choices that are low in fat. Better yet, grab an ounce of raw nuts or add some beans to your salad. Include a proper cool down in your workout. Taking 10 minutes at the end of your workout to cool down will help your muscles recover faster. A cool down should include some walking or slow jogging, plus plenty of stretching to relax your muscles. Apply heat pads. Heated wraps and pads have proven effective in reducing the pain from workout soreness, especially if it is localized. Heat traps won't help you much if every muscle is aching. Heat has been proven to reduce inflammation and reduce the soreness. Take acetaminophen or another form of anti-inflammatory medication. Taking an anti-inflammatory medicine as prescribed can aid in reducing muscle soreness. If using an over-the-counter product, be sure to follow the dosing guidelines. Drink cherry juice. A study published in the British Journal of Sports Medicine reported that drinking cherry juice before and after a workout could reduce muscle soreness. Cherries have long been rumored to have beneficial effects on muscles, but this study was the first of its kind. Don't overdo it. The best way to avoid intense muscle soreness after a workout is to not overdo the workout. Listen to your body. If you begin to feel soreness and muscle fatigue, then stop. The more you push your muscles, the more they will be sore and the greater the risk of causing real damage to your muscles. Causes. Although the exact cause of scoliosis is unknown, genetics is believed to play a role, as it often runs in families. When scoliosis develops later in childhood, there's usually no cause found in over 80% of cases. The rest can be due to conditions such as polio, cerebral palsy, juvenile osteoporosis, or other disease. This condition is also associated with poor posture. In fact, scoliosis is the cause of poor posture in many cases. Adults may develop functional scoliosis in the presence of severe muscle spasm caused by muscle strain, other injury, or degeneration of the spine. In the case of muscle spasms or strains, scoliosis resolves with treatment of the underlying problem. Symptoms and complications. Although the spine's curvature is unnaturally bent in individuals with scoliosis, there are usually no symptoms. Some people may experience vague muscle back pain, stiffness, or fatigue. Most curves are convex to the right in the upper back and to the left in the lower back, so that the right shoulder is higher than the left one. One hip may also be higher than the other. A parent or friend may notice that the spine appears curved, and the ribs on one side of the body will appear closer together compared to the other side. Developing scoliosis may go undetected for years until a child reaches adolescence. As the child enters puberty, and is growing more quickly, the degree of spinal bending can dramatically increase and become very noticeable. There are different degrees of scoliosis. Very mild scoliosis usually doesn't require any treatment other than regular follow-up with a doctor, since it generally doesn't cause any symptoms. For those with more severe scoliosis, back muscle fatigue and pain may be felt during prolonged periods of standing or sitting. In some people, the condition can progress and worsen with time. The abnormal compression of the ribs on one side of the body can put pressure on vital organs and can cause a change in function of the heart and lungs if left untreated. Making the diagnosis. Mild scoliosis may be detected during a routine physical examination. Usually a doctor may suspect scoliosis when a child has one shoulder that seems higher than the other, or when clothes don't seem to hang right on a child. In most cases, the doctor will be able to diagnose scoliosis based on a simple, forward bending test. The doctor will examine the levels of the shoulders and shoulder blades and the curve of the ribs as the child or adolescent bends slowly forward. A greater dip in one shoulder usually is a sign of scoliosis. Ribs may be curved differently from one side to the other. X-rays aren't always necessary but may be used to determine the severity of the spine's curvature. Treatment and prevention. Treatment will be based on the severity of the spine's curvature. In the mild cases, treatment isn't necessary. The more severe the curve, the greater the chances that the condition will progress. About 50% of children with scoliosis will need some form of treatment or at least require close follow-up with a doctor. Prompt treatment will usually prevent the condition from worsening. For progressive scoliosis, a customized brace or plaster cast will be needed to hold the spine straight. The brace is made to extend from the hips to the neck and must be worn for about 23 hours a day. The brace is worn until the skeleton stops growing rapidly, which is usually when adolescents have almost reached full height. For many young patients, wearing a brace to school can be very stressful and frustrating. Counseling and support can help children and adolescents adjust and deal with negative feelings and concerns. Without the help of the brace, and sometimes despite brace use, the scoliosis can get worse and surgery may be required. In very severe cases, surgical correction of the spine may be necessary and most commonly involves a spinal fusion with attachment of metal rods to the spine. In the majority of cases, a back brace or surgery helps correct the problem. Another treatment sometimes used is electrospinal stimulation. In this procedure, the spinal muscles are stimulated with tiny electrical currents and strengthened, and this may help straighten out the spine. A family history of scoliosis is an important risk factor. If you have a family history of scoliosis, take your child to see your family doctor or a pediatrician for early screening.